So there are several mechanisms underlying the association between obstructive sleep apnea and cardiovascular risk. The things that we know are present are increased sympathetic tone, which leads to vasoconstriction and hypertension. There is also intermittent hypoxia, which can lead to an inflammatory state and vascular injury. Interestingly, women have not been thought to be at risk for cardiovascular disease for many, many years, but recently we have had several studies that have shown a significant association. So women in particular have a few different problems. Number one, their symptoms are very different than men, so they are not diagnosed with obstructive sleep apnea in a timely fashion. Second, once they are diagnosed, they are at a higher risk of cardiovascular events than men. Certainly, that has yet to be fully proven, but a couple studies now have shown an increased risk for women with cardiovascular disease who have obstructive sleep apnea compared to men with the same obstructive sleep apnea. So first of all, we need to screen them for it more often and have awareness in the primary care doctors as well as other doctors to say these women might be at risk for obstructive sleep apnea and get them diagnosed early. If they're diagnosed early, they're treated early, and therefore the downstream consequences are less. So there are multiple studies, most of them in men, showing that treating obstructive sleep apnea with continuous positive airway pressure does reduce blood pressure, reduces overall cardiovascular morbidity and mortality. It also improves left ventricular heart function. These studies need to be replicated with more women in them to show that treating obstructive sleep apnea in women does have long-term consequences of improving their cardiovascular risk. So we need to understand whether or not the underlying mechanism of why cardiovascular disease exists in obstructive sleep apnea is similar in women as it is in men, and then to find out whether or not the treatment that we're currently doing for obstructive sleep apnea is as effective in women as it is in men.